all had forgetful moments, forgetting a homework assignment or leaving our phone somewhere. Luckily for us, these moments are temporary. 5.5 million people in America aren't as fortunate.
What's the difference between dementia and Alzheimer's?
Well, dementia is kind of like the symptoms for Alzheimer's. It's more just like memory loss, like loss of communication, and just like kind of just like overall, it's the term for some like the symptoms of Alzheimer's, and like it's the umbrella term. So like there are a lot of different types of dementia, like vascular dementia or Alzheimer's, and most cases of Alzheimer's. Most cases of dementia are caused by Alzheimer's, but not all of them.
It's an overall scary experience. First, memories seem to slip away, then the diagnosis.
My great-grandmother has dementia. How is that?
She's beginning to forget a lot more. She used to give us like a card, like send it, because she lives in Cape Cod, she would send us a card every year on her birthday, like exactly on her birthday, like a superpower. And now she doesn't even remember people's birthdays, even her own kids. When you like talk to her, she kind of just like stares blankly, like she stares blankly. She doesn't really respond. It kind of seems like she's checked out of conversations, and like she's not really paying attention anymore. And the other day, I think it was like yesterday, she called the ambulance for herself because she was having trouble breathing, and it's because she keeps forgetting to take her breathing meds because she just can't remember to do it anymore. And she has someone who comes in like and checks on her every day, but my grandmother is worried that it's not going to be enough anymore, and it's like a serious threat that she would like burn her house down or something. She's like by just forgetting to turn off the stove or something. And my grandmother is currently trying to convince her to move into an assisted living home, but she is very adamant about not wanting to move because she says that Robert is in that house because Robert is my great-grandfather, and they lived in that house for most of their married lives together, and when he died, she took it really hard, and her dementia symptoms got a lot worse, and she's just not willing to move out because she wants to die with the same place that he died.
How are you related to the patient?
daughter, 할아버지 부인.
How often do you visit the patient in the nursing home?
One day a month, every month one day. 한 달에?
네.
저기 할아버지 한 뭐 5박 6일 2박 3일 그래 모시고 그래요. 집에 이제 그 요양원에 갔다가 계시다가 또 집에 초대해가 들고 있다가 또 보내고 한 달에 보러만 여와 있어도 되고 보러만 거기에 계시도 되고 그래요.
How often does the patient visit the doctor?
다시 잘 모르겠다. 한국어로 해줘.
할아버지가 의사를 얼마나 많이 봐요?
그러니까 할아버지는 의사는 한 달에 한 번 정도 그 양로원으로 오시고 요양으로 오시고 간호원은 항상 상주하고 있어. 항상 계셔.
하고 간호사는 약 배우는 사람이에요? 공부한 사람이에요?
간호사.
그래서 맨날 무슨 프로페셔널이랑 보내요? 매일은?
그러니까 이제 간호사는 뭐 이게 그쪽에서 직원들이 할아버지 상태를 보고 안 좋으면은 뭐 약이나 뭐 이런 거 이제 해주고 치료해주고 이제 뭐 많이 좀 안 좋다 하면은 이제 의사가 이게 공식적으로는 한 달에 한 번 방문해가지고 이제 다 검진하시고 또 많이 아프시면은 의사를 또 따로 불러 요양원으로.
How would you describe the patient's typical day, common day?
하루 일정이 어떠냐고.
할아버지는 보면 아침에 이제 그 평상시처럼 그냥 아침, 점심, 저녁 세 끼 드시고 중간에 간식 드시고 그리고 또 저기 뭐 TV를 시청하시든가 아니면은 그 복지사들이 이제 매일은 안 오지만 뭐 일주일에 2번 정도 오시면은 같이 이제 뭐 운동하시고 율동하시고 노래하고 아니면 이제 자원봉사자들이 가끔가다 오면은 또 같이 뭐 율동하고 노래하고 그렇게 하셔.
체력되는 일 뭐 저런 것은 많이는 안 하죠.
일은 안 하시죠.
체육 때문에 많이 이제 할아버지 같은 경우는 올해 그 운동을 많이 이제 안 하시니까 근육이 퇴화돼서 주로 휠체어를 타고 계시기 때문에 운동 같은 거 이렇게 따로 많이 하시고 많이 돌아다니시고 그렇게는 못 하시고 그냥 계속 휠체어에 앉아 계시고 휠체어에서 생활하셔. 그리고 누워 계시고.
네. 그래서 what responsibilities come along with taking care of someone with Alzheimer's?
할아버지 그러니까 이제 우리 가족들이 뭐 그 요양원에다가 이제 또 요양원비를 내고 또 이렇게 집으로 뭐 외박 그런 기능이 있어가지고 집으로 이제 뭐 한 달에 한 번씩 두 번씩 모시고 오시거나 2박 3일, 3박 4일로 아니면은 뭐 면회를 가가지고 이제 음식을 가지고 가서 면회를 가가지고 거기서 이제 면회실에서 할아버지 만나고 그렇게 해.
하고 할아버지가 아직도 집에 살아 있을 때 아무 약 아니면 저런 거 할아버지한테 줬어요? 무슨 뭐 운동 저런
할아버지 집에 계실 때는 이제 지금도 그 요양원에서도 이게 그 약을 그 다른 병원에서 가지고 와가지고 약은 계속 하루에 계속 드시고 집에 있을 때도 계속 오랫동안 이제 계속 집에서 약을 드시다가 대소변을 못 가려셔가지고 이제 집에서 너무 돌보기가 힘들어서 처음부터 요양원에 계신 건 아니고 대소변을 못 가려서 이제 집에 계속 못 다가 결국에는 집에서 어떻게 할 수가 없어서 이제 요양원으로 가시고 약은 계속 드시지. 그리고 3개월에 한 번씩 병원 가서 3개월치를 약을 받아다가 요양원에 가주고.
그래서 할아버지가 얼마나 동안 집에 있었고 언제 결정을 내렸어요? 이제 집에서 더 이상 못 살아.
할아버지가 그 치매 판정 받고 나서 한 6, 7년 정도 계속 집에 계셨고 이제 그 삼촌하고 또 계속 일을 해야 되기 때문에 집에서 이제 할아버지가 결정적으로 그 요양원에 가시게 된 계기는 이제 그 대소변을 집에서 가릴 수가 없어가 대소변을 스스로 이제 못 가려서 도저히 할머니도 연세가 많으시고 돌봐줄 가족이 이제 별로 없기 때문에 어쩔 수 없이 한국 사회는 그거 요양원에 보내는 걸 되게 이제 좀 꺼려하는데 어쩔 수가 없어서 요양원에 보내신 거야. 가장 큰 계기는 이제 대소변이 못 가려서.
할아버지 상태를 조금 설명해 줄래요? 지금의 뭘 할 수 있고 뭘 할 수 없고 저런 것들.
할아버지가 뭐 할 수 없는 일은 전혀 아무것도 못하고 기억도 못하고 자기 부인도 몰라보고 아들 딸도 몰라보고 정신이 완전 없어. 기억력을 다 잊어버리고 옛날에 이제 그냥 자기 살던 고향 그것밖에 생각 못해요.
And now I will read the transcript of a patient interview with Ori, diagnosed with dementia. How did your life change after your diagnosis? I noticed that people seem to be more careful around me. I get a lot more checkups at home now. The changes in my behavior have been gradual and I barely notice, although my children and friends say my short-term memory is getting worse. Since it is so early, nothing major about my life has changed, and I don't currently need assisted living.
Now, an interview from Christina Zendeas, a geriatric psychiatrist at UConn.
How do you cope with losing patients while working in geriatrics, specifically in regards to Alzheimer's?
It is hard to work with patients who have chronic terminal illnesses. I frequently start treating patients in the earliest stages of Alzheimer's and watch them decline over many years in terms of their condition and ability to care for themselves. Ways I cope include working in a team with social workers, geriatricians, neurologists, care managers, residents, hospice services, thinking about my job as being a support to patients and their family members, learning to accept the life cycle with inevitability of death, and helping patients to be as independent and comfortable as possible for as long as possible. Also, as a geriatric psychiatrist, I appreciate the value of having my own therapist for when the job gets difficult.
Are there any medical interventions that seem promising for the future?
There's a lot of research currently happening in the field of Alzheimer's disease. The key focus of research now includes early identification, because the brain changes of Alzheimer's disease start many years before the memory problems start, and once identified, strategies to stop the disease before symptoms begin. Emphasis on diet, exercise, blood pressure control, and lifestyle modifications that may postpone the onset of disease. If by 2025 we have a strategy to delay onset of Alzheimer's disease by 5 years, then 5.7 million people who are expected to develop Alzheimer's will not have it in 2050. That is approximately the number of people who have it in the U.S. now.
How is Alzheimer's diagnosed?
Doctors obtain a history regarding concerning symptoms, what is happening, what are associated symptoms, how long has it been going on, how is the functioning impacted, etc. We perform a physical exam. We obtain blood work to rule out other causes of memory problems, such as thyroid disease, B12 deficiency, vascular disease. We also look for psychiatric illnesses that might be masquerading as a cognitive disorder. For example, people with depression may have difficulty with concentration and memory. We get brain imaging, such as an MRI, to look at the brain, although Alzheimer's does not show on these scans, and the purpose is to rule out if there's been a stroke, a brain tumor, or other potential disease process that could be causing cognitive symptoms. We're in neuropsychological testing, which is helpful to quantify deficits and also narrow the possible diagnosis. It used to be that Alzheimer's could only be diagnosed for certain on autopsy, but we now have brain imaging called a PET scan that shows patterns of brain activity that are consistent with Alzheimer's. The problem is that most insurances will not pay for this type of test yet.
What is happening in the brain of a patient with Alzheimer's?
There are several changes in the brain. One is the size of the brain shrinks. All brains get smaller as people get older, but Alzheimer's patients have a disproportionate reduction in brain size, and this is especially true in the area of the brain called the hippocampus, which is responsible for memory formation. There are two types of proteins that are found in the brain of Alzheimer's patients. One is called amyloid, and this protein makes plaques that form outside the neurons. There has been a lot of research looking at clearing out these plaques by using something called a monoclonal antibody, and if that could be a potential treatment for Alzheimer's. But so far the data has not shown cognitive benefit even when the plaques are cleared out. The other class of protein found in Alzheimer's patients is called tau. This is inside the neurons and causes something called tangles in the neurons that make the neurons non-functional.
What other body systems are impacted by Alzheimer's?
Alzheimer's patients gradually become weaker physically. In end-stage Alzheimer's, they are bedbound and unable to walk or speak. In very late stages, they cannot even hold their heads up.
What are the patient's symptoms?
The classic presentation of Alzheimer's is forgetfulness and an inability to form new memories. As the disease progresses, they may even forget long-term memories and the names or faces of people close to them. Alzheimer's always affects other parts of cognition as well, although these types of deficits may vary from person to person. Some cognitive domains affected may include speech, visuospatial ability, attention, concentration, problem solving, and social skills. Behavioral symptoms are common and may include disruption of sleep, depression, anxiety, psychosis, hallucinations or paranoid thinking, agitation, and aggression. Functional changes may include difficulty initially with driving, managing medications, cooking, managing finances, shopping, using a telephone, or doing housework. As the disease progresses, so do functional deficits, and they may have difficulty walking, using the bathroom independently, bathing, dressing, or using a knife and fork to eat.
Does Alzheimer's make patients a danger to themselves or others?
Patients with Alzheimer's disease who are more
who are more progressed cannot take care of themselves independently. For example, they may not be able to recognize a problem in the environment that might be a danger or come up with a plan to solve it, such as if a pan on the stove catches fire. They also might not be able to use a phone or have the right words to call for help. Another big risk is that patients may wander off and get lost if left alone. Usually, Alzheimer's patients are not a danger to others, but they can become so if they have problems with aggression or agitation.
Is staying in nursing homes or at home better for people with Alzheimer's?
Every patient and family is different. Sometimes people feel guilty about putting a loved one in a nursing home, but often they are not equipped to deal with the hands-on care needed as the disease progresses. I try to validate for families that this is a terrible disease for which there is no perfect solution, and we try to come up with the best solution for everyone involved. There is no right or wrong answer, and if we try one approach and it doesn't work, then we can move to another approach. I have had patients whose families try to keep them in the home, but they realize that they can't because of the physical and emotional demands, so they place their loved one in a nursing facility and then realize that the quality of time that they spend together is better because someone else is taking care of the basic care needs. Alternatively, I have had families place a patient in a nursing home who then bring them home because they think they can meet the patient's needs better.